tissue releases and osteotomies before the age of 2 years to facilitate mobilization. Now, osteogenesis imperfecta, in this, the bones are osteoporotic, brittle, and easily fractured. Joints are hypermobile and frequently dislocated. Children with osteogenesis imperfecta present for emergency treatment of fractures and correction of deformities, including multiple site osteotomies. Dwarfism. The most common form of dwarfism is achondroplasia. Common orthopedic procedures include limb lengthening technique, joint replacement, and limb realignment. Now, the pre-operative evaluation. The pre-operative evaluation, it varies with the age and the medical condition of the child. Planning is best done in conjunction with the surgeon to be aware of the location of the incision site, to plan a regional technique, the length of the procedure, and any individual surgical preference. Now, there may be certain related conditions which have to be taken into account. A thorough history of related diagnosis is essential. Important comorbidities, they include scoliosis and restrictive pulmonary disease, congenital or acquired cardiac lesions, craniocervical and facial abnormalities, hydrocephalus, dental disease, and obesity. Pre-existing neurological deficit, contractures, deformities, and fractures should also be carefully documented to aid the planning of positioning and handling. Obstructive sleep apnea. This is especially common in dwarfism, either secondary to cervicomedullary cord compression, which is the central OSA, or as a result of thickened pharyngeal and laryngeal structures, narrowed nasal passages, micrognathia, pharyngeal hypoplasia,